You've been asking me this frequently lately. Sir, did heart diseases occur at a very early age? Actually, there is some truth to this, but with our early diagnosis, this probability has increased. So, can I recognize heart diseases early? Can I recognize this before I feel the need for any examination and before I come for any examination? In this video, I will talk about 10 hidden symptoms of heart diseases. If you're ready, let's start. I gave heart diseases as a general title because heart attack is not the only event here, and heart attack is not the only disease of the heart. There are many diseases of the heart, such as heart failure, rhythm problems. So, if you have any of the 10 items, I recommend you to have a heart-related examination. Our first item is a feeling of uneasiness in the chest. Chest pain is not the only complaint of the heart. Palpitations are not the only complaint of the heart. If you frequently feel discomfort in your chest area, especially discomfort in the middle of your chest that occurs with exertion, wakes you up, or after heavy meals, please go to a cardiologist, because studies have shown that patients who have a heart attack have a heart attack. Look, I'm talking about the period before the attack. In other words, it shows that there is a feeling of discomfort in the chest even when they feel completely normal. So before your chest hurts, you may actually feel discomfort in the area. I'm not telling you this. If you have chest discomfort, do not go to cardiology immediately. If exertion occurs, if you have high familial risk factors, if you smoke, if your cholesterol is high, and if you frequently have a feeling of discomfort in the chest that lasts for more than 5 minutes and less than half an hour, I recommend that you get examined, even if there is no feeling of complete pressure, because restlessness can be a symptom of heart disease. The second is abdominal problems. Chest pain is not the only pain of a heart attack. Sometimes there may be pain and complaints in the form of burning in the stomach, abdominal pain, nausea, and vomiting. These may also be symptoms of a heart attack. In fact, we can see abdominal swelling as the only complaint in some heart failure patients. The patient comes to us. My doctor says my belly is swollen, and we see that there is heart failure. This is not something we see often, but abdominal pain, especially heartburn, because it can be confused with heartburn and heartache. Please go to cardiology. This is probably gastritis. I guess there's an uneasiness in my stomach. Don't say it's probably not from the heart. Please do not forget to go to a cardiologist if you have a new abdominal condition accompanied by nausea and vomiting. Even if you have received emergency treatment here, get a cardiology examination and tell your doctor about it. Get an ECG and have an ultrasound. Some additional imaging may be required, and it may be necessary to investigate whether there is a heart-related disease. The third is arm pain. As they always say, heartache hits the left. There are many people who say, "Sir, my finger is numb. I wonder if it's from the heart." Look, the numbness of this finger alone is not due to the heart, even if it is on the left side. Numbness in just these two fingers is usually not caused by the heart, but heartache doesn't always hit the left. Pain in the right side of the chest, if it is pressure-like, hits the arm or hits the chin, should also be considered as heart pain. Why am I saying this? Because sometimes heart pain may occur in atypical forms. That is, it may be reflected to the right side rather than to the left, and this may need to be evaluated as heart pain. Please don't say that. If my right arm hurts, it's okay, then it's not from the heart. Both right-sided chest pain and right-sided arm pain should be considered as heart pain and should take you to the doctor. The fourth is the feeling of dizziness and lightheadedness. This finding is especially important for women because men feel the symptoms of heart attack a little more keenly. We see burning and pressure in the chest in more typical forms, but especially in women. If there is no neurological problem, sudden onset, rapidly increasing dizziness and lightheadedness may be a symptom of heart disease. Of course, in such a situation, you will go to the emergency room, and if there is a heart-related crisis, a diagnosis will be made because an ECG will be taken. But if these complaints continue, if you feel bad, and if you realize that these complaints are now endangering your daily life, please make an appointment with cardiology. Because after a heart attack, there may be blood pressure instability and pulse instability. And this may manifest itself not in the form of pain, but as a feeling of dizziness and lightheadedness. This is not a rare finding. It can also occur in men, and sudden onset of dizziness can sometimes be a sudden slowing of the heart rate, and slowing of the heart rate can also be a sign of a heart attack. Sudden feeling of lightheadedness Sudden dizziness may be a sign of heart disease in a completely healthy individual if no neurological problem is found and should take you to a cardiologist. Fifth is jaw pain. It is very typical in heart diseases. Chest pain is not expected all the time. If a patient tells me, doctor, it's like I had an apple in my esophagus and it stayed there. It's like there's a quincy left here. If my doctor sometimes describes complaints such as squeezing my jaw or hitting my lower jaw, the heart should be considered first until proven otherwise. Jaw pain may be a sign of heart disease. If you feel pain, especially in the lower part of the jaw towards the esophagus, that is, if there is pain in the upper chest towards the chin, this should take you to a cardiologist. Why am I saying this? Sometimes patients even say that clenching the jaw makes them feel like they are clenching their teeth, because the nerve spread of the heart can sometimes extend to the upper jaw. So what I'm trying to say is that jaw-related events may not always be related to teeth. It may also be heart-related. The sixth is to get tired early. Getting tired early should be considered a sign of heart disease until proven otherwise. Why am I saying this? Because in heart failure or after a previous attack or some other heart diseases such as valve disease, valve stenosis, the only symptom may be early fatigue. And as a cardiologist, I say that early fatigue is not a rare situation. When heart patients come to us and their doctor says, I used to climb 3 flights of stairs, but now I climb 1 flight of stairs. I feel out of breath when I climb more than 1 floor. I get tired, I get blocked. This is considered a heart disease. An advanced test may be required. Getting tired early, sir. My effort has decreased and I also smoke. I guess you can't say it's because of smoking. First, heart diseases should be excluded. Diagnosis is easy. ECG is taken. Echocardiography is performed. A stress test can be performed, or some additional tests can determine whether there is a condition in the heart. I'm not trying to say that here. If you get tired early, I'm not saying you have heart disease, but early fatigue may be the only symptom of heart disease. I say, please take this seriously and go to cardiology. Getting tired early may not be due to muscle pain, but actually to your heart. So don't say, sir, my leg's cut off while I'm walking. Probably not from the heart. Doctor, I'm a little bit short of breath. I guess it's because of my lungs, don't say. Come to cardiology and we will diagnose whether you have a heart attack or heart failure. Let's be sure. Then we may need to refine it to other sections. First the heart, then the others. Seventh is shortness of breath. Your effort capacity may be good. You may still be climbing stairs. If you feel short of breath and out of breath while climbing 2 flights of stairs, you should think about your heart again until proven otherwise. See why these are important to us? Because if the cause of an event is the heart, this event is important. If the cause of an event is the heart, it must be eliminated quickly and a diagnosis must be made. If the onset of shortness of breath reduces your effort capacity and shortens your walking distance, first of all, it should be checked to see if there is anything related to the heart. The reason why the heart should be considered first is this. Is it a sign of an emerging crisis? Since we cannot distinguish whether it is in the early or late stages, it is necessary to come and be examined quickly. If you have recently started shortness of breath, please go to a cardiologist. Another heart-related symptom, perhaps even the only symptom, is swelling in the legs. A patient with swelling in the legs usually goes to 3 departments. He goes to a cardiologist because one of the reasons is heart failure. Secondly, to a cardiovascular surgeon because venous insufficiency can cause swelling in the legs. The third goes to nephrology because protein leaks can cause edema accumulation in the body, which can swell the legs. Look, I'm telling you, cardiology first. First, is there heart failure or not? If your leg is swollen and you think that this edema did not exist in the past, if you think, see or notice that your legs have started to swell recently and that it is gradually increasing, you should first come to the cardiologist, because the only symptom of heart failure may be swelling in the legs. While deficiencies on the left side of the heart manifest themselves as shortness of breath, deficiencies on the right side of the heart can swell the legs, and this may be the only symptom. Sometimes there may be swelling in the abdomen. Look, I'm telling you, since the legs are the lowest organs in the body, edema will accumulate in the legs first due to the force of gravity. And if you have swelling in your legs, which is a common symptom of heart failure, we should definitely go to a cardiologist. Another symptom is cold sweats. If a patient is elderly, has no chest pain, is a smoker, has one of the risk factors, or has high blood pressure. If someone says that I have cold sweats while walking, but my chest does not hurt at all, it is not congested at all, but I have cold sweats, first consult a cardiologist, because cold sweating may be a symptom of heart disease due to the development of heart failure due to the decrease in the effort capacity of the heart. If your sweating increases with exertion, look, I'm talking about cold sweating. So the environment was hot, you exerted yourself and you sweated. This is acceptable, but the weather is not hot. You are sweating coldly. You see that your bet is running out of gas. You see your heart rate rising. Complaints that occur with exertion are related to the heart until proven otherwise. If a heart-related cold sweating cause cannot be found, then you can go to other departments. Then the reasons can be investigated, but first cardiology. The last and 10th item is cough. A persistent cough that lasts longer than 6 weeks may be one of the causes of chronic cough. Cough may occur most commonly due to benign diseases, asthma, upper respiratory tract infections, and some allergic reactions. But if you have a cough that does not go away and lasts longer than 6 weeks, I recommend that you first go to chest diseases and then come to cardiology, because cough alone can be a sign of heart failure. During the course of heart failure, edema may accumulate in the alveoli of the lungs, which may cause coughing in the body. Because the edema accumulated, there will be tried to be removed from there in some way, and this can only be done by coughing. Sometimes shortness of breath, sometimes cough. If you have long-lasting complaints, you should definitely go to cardiology. Don't ask what cough has to do with the heart. Believe me, if heart failure patients are not noticed, they may present with edema in the lungs and only cough. Sometimes heart medications can also cause cough. For example, the blood pressure medications we give can sometimes cause cough, and this situation can be resolved when we stop the medication. However, if there is no medication available and the cough alone is a chronic cough that lasts longer than 6 weeks, you should be investigated for heart failure and you should definitely see a cardiologist. In this video, I tried to list the items that I am frequently asked about heart disease and ask if I have it too. If you have any of these 10 items, if you have risk factors in your family, or if you have high risk factors, please go to a cardiologist, because each of these alone can be a symptom of heart disease. Please don't forget to subscribe to our channel, turn on notifications, and stay tuned. Goodbye.